system has to pick up oxygen from what's called your pulmonary system. We're not going to do the pulmonary system today, but that's your lungs. Pulmonary means lungs. And this is a very interesting thing about large mammals, which is what we are. So you don't need a heart and lungs if you're a bug. So like things like cockroaches and things like that don't breathe in the way we think they do. They do use oxygen, but they use it passively. It basically flows through holes in their body, and it's enough oxygen to keep them moving. And that system actually works really well for tiny things. As they get bigger, there's not enough oxygen and blood flow to keep them going. You need to ramp that up. So, Mr. Brown, this should make sense to you actually, sir, as a car buff. But the bigger and more powerful your vehicle is, the more air and gasoline it needs. And people are actually very similar. I know you guys don't use gasoline, but you do use oxygen to help certain chemical reactions produce ATP and actually give you the fuel to survive. So a carburetor in a car, its job is to take air in and mix it with gas. Your lungs' job is to take air in and mix it with blood. To kind of use for chemical combustion. And as we got larger, you needed better and better ways to do that. And so you have lungs that are these giant carburetors, and that allowed human beings to get to be the size they are. You can't get to be kind of mammalian sized if you don't have lungs and a heart to move a lot of product around your body, a lot of gasoline, a lot of oxygen around your body, and get stuff in and out very efficiently. So we aren't going to be doing the pulmonary system today, but we're going to be talking about how you muscularly, I don't think it's a word, but anyway, how you use your muscles to breathe. So we'll be talking about the breathing muscles today, the muscles you use to expand and contract your rib cage. And what I want you to think about today before we kind of get into the meat of all this is just this kind of simple concept like how your lungs actually work and why we need to expand your rib cage and why that actually makes you breathe. So if you have, I don't even know how to draw a rib cage, but if you have a rib cage here, if that's my crummy rib cage that you can probably barely see, if you have sacs in here, which are your lungs, if you expand that rib cage, it causes the sacs to expand, and that makes them want to suck air in. So your lungs don't really do the exact expanding, your rib cage does, and that makes your lungs expand, and when they do, it creates a vacuum. And literally that's how you breathe. So anything that expands your rib cage will cause you to inhale. Anything that expands your rib cage will cause you to inhale, and anytime you collapse your rib cage, you'll exhale. Now, your rib cage is rather springy, and so most of your exhaling happens without any what we call forced exhalation. Most of your breathing out happens just because you let go of expansion and your rib cage just falls back down and you breathe out. So most of your exhaling is, you're not thinking about it, you don't need to do a lot, that's fine. But there are times when you need to breathe faster. And believe it or not, breathing faster involves not just breathing in faster, but I'd like to get the carbon dioxide out faster too. So I'd like to actually do forced exhalation. And we have muscles that can pull your rib cage down and cause you to breathe out faster. And we have muscles that can lift your rib cage up and allow you to breathe in faster. We don't normally use those supportive muscles in regular breathing, but we do when we are running, lifting weights, when we need more oxygen. So your main breathing muscle that you do use all the time is called the diaphragm. And this is very hard to imagine because I just drew a U to show it, but it's a three-dimensional U. It looks like an umbrella inside your rib cage. So if we'll have some pictures too that I think will help show this, but it really is an umbrella up inside your rib cage. It looks like a mushroom, actually, inside your rib cage. And I would hope that you could see that if this is a muscle right here, your diaphragm, and it contracts, it will actually get shorter, right? Because that's all it can do. What happens when that muscle gets shorter? Anybody? What's it going to look like if it gets shorter? If it's locked down here and here, what happens if it gets shorter?
We get flat.
Yes! Yes, I saw you were 100% correct. And Miss McDowell, I saw you do this. I loved it. Thank you. It gets flat. It goes like this. That's actually it contracting. Well, when it gets flat, what happens to the volume inside here? You create a vacuum. These bags get dragged down here and air comes in. So you actually contract your diaphragm to do this. Now I don't have to do anything but just let my diaphragm go. And it'll pop back up. And that's just normal breathing. So we always use our diaphragm for inhalation. We will use some of these other supporting muscles when we want to do faster inhalation and exhalation. And I'll talk about those muscles with you. But we're going to learn about some new serratus muscles. Remember, serratus means saw-like. And so we will do some new serratus muscles that are in back. So you guys have learned about serratus anterior, which comes around my ribs, comes from behind my medial border of my scapula, hooks to my first 8 or 9 ribs. These are posterior serratus muscles. They look like little sawtooth things too, but their job is to raise and lower your ribs. We're also going to learn about the intercostals today. And intercostal means between the costals, and costals are ribs. So we'll also learn about meat between your ribs that actually helps them expand and pull closer together too, which you use again when you are doing forced inhalation and exhalation. And we'll talk about those too. So basically, you've got one breathing muscle, one main breathing muscle, that's your diaphragm. When it's relaxed, it looks like this. When it's taut and contracted, it actually looks like this, and that's what pulls the air into your lungs. And then you've got, depending on how you count them, 3 to 4 supporting muscles for when you are, needing extra oxygen, extra fast, and you have to breathe really hard. So, why are we teaching this in massage therapy? Why is breathing important in massage therapy? I mean, I guess the real answer is breathing's always important, right? But we see a true stress and breathing connection, right? And I know my yoga people are like, of course you do. And breath, in yoga, it's breath is life, right? And massage is really saying the same thing. When I say blood is life, it's because I want the breath to get to the area via the blood. So we're saying the same thing. What did I want to say? But what we see when we see tension in people is sometimes some of the muscles that get tense are their breathing muscles. And if you're feeling some anxiety and then your muscles tighten up, it feels like you can't breathe, right? And so some of our tense clients actually need us to help release these muscles, not so much their diaphragm, although we're going to talk about that too, but some of these other supporting muscles because their rib cage can actually be locked down. Now, before we even get to these, I do want to remind you that the biggest culprits of locking rib cages down are the muscles that attach to the medial border of your scapula, because a lot of those muscles compete with one another. So there are, depending on how you count them, again, 1, 2, 3, 4 muscles that attach to the medial border of your scapula. And Miss McDowell is going to tell us what those 4 muscles are because she loves you guys and she wants you to know. I don't know if you know or not, man, but try. Give it a whack.
Medial border of the scapula. So you're talking pec minor.
No. You were right, pec minor attached to the scapula, but not the medial border. This border back here. Right back in here.
Don't distract me. You're not in this class. I was distracted. I can't.
It's okay. Do you want me to pass? I call on you a lot, so I just did it to, like, if you want to pass, you've earned it.
I mean, could you lead me in the right direction?
Yeah. Look. Let me tell you how I think about it all the time because it'll help you in the future. So this is a scapula. This is actually a right scapula. If it was on my body, it would be like this.
Mm-hmm.
So we are looking at it as though you're looking at my back, okay?
Oh, wait, I was thinking lateral border.
Yeah, because
Okay.
it's the pec minor hooks here in front. But we're talking about this thing back. We're talking about stuff that hooks the scapula to the spine and to the ribs.
Okay, yeah, so rhomboids major and minor.
Perfect.
Would you take serratus anterior?
Yes, that's actually what. There's also levator scapula, but that's what I wanted to hear you say.
Yeah.
Rhomboids major and minor come here and hook to the spine, and then from the same border, the serratus comes around to the front. Does that make sense?
Yeah, sorry,
Okay.
put a candle. Okay.
Okay. And of course there's a levator scapula up here, everybody, but it's really the rhomboids and serratus anterior. So if you think about it for a second, you can have a muscle hooked to here, the rhomboids, hooked to the scapula, hooked to the serratus anterior that comes all the way around almost to the front. Well, if I'm tense, my rhomboids tend to pull back and retract, and my serratus anterior tries to protract and pull forward. But what they're doing is squeezing my rib cage down. So try this even with some of your clients. I'll have clients come in and they're like, oh, my shoulders are so tight. And I will often ask them, is it hard to take a deep breath? And some say no, and it's not. And then I'm like, well, they're probably not completely locked down in this area. But a lot of people will actually go, oh, it is. I didn't think about it because they're not running. They're not going around. So they're shallow breathing. It's fine for them. The minute they try to take a deep breath, they realize how tight their chest is. And that, anxiety and stress and these muscles all kind of play together. And when the serratus anterior is fighting with the rhomboids, it locks down your entire rib cage. And when you can't breathe well and deep, it makes you anxious and makes you more tense. So that is a case where muscles are stopping your breathing apparatus. We're now going deeper today, and we're going to look at the assisting muscles that actually help you breathe because sometimes those are a problem too. And these can be a problem with people with stress and tension. These could also be useful for athletes. If you can make your athlete breathe better, you just put a bigger carburetor on the engine. And you have a faster athlete, stronger athlete. So that's the other kind of cool thing about this, because those are two very different clientele and two very different selling points that are very important. This is the I'm stressed out anxiety. My ribs are all locked up. I have a hard time breathing, which makes me stressed and anxious, which makes me worse and worse. And this is the athlete over here who, oh my gosh, you've freed up my rib cage. I can breathe better. I can actually run farther. I'm actually better at endurance sports, things like that, which is a very cool thing to do. And athletes will obviously pay for increased performance. Like, that's a big offering. Okay. Cool? That was a good job, Miss McDowell. It really was. Like, it's a lot to pull that out of the blue right there. Okay. All right, so let's look at this slideshow. And talk about it. And talk about these nifty, neat muscles that aid in breathing. Okay. So chapter 4, spine and thorax. Okay. So some of the muscles we are talking about here are really deep. They're kind of the spinal erector level, the erector spinae level. And I don't know if you can see this picture right here, but do you see the serratus posterior superior and the serratus posterior inferior on the left-hand side? Okay. So during this course, as far as I can remember, you will only learn about 3 serratus muscles. So we're going to do the other 2 today. Serratus means saw-like, so they always have these kind of teeth-like projections. They always love to go to the ribs. That's why they're called serratus. They're always kind of grabbing onto ribs. And they're labeled by location, essentially, right? Serratus anterior is found creeping around the front. You've got 2 serratus posteriors. You got one on top and one on bottom. So serratus posterior superior, serratus posterior inferior. They're really just saying saw-like muscle in back on top, saw-like muscle in back on bottom. That's really what they're saying. And then you've got a saw-like muscle in front, because there's only one in front, so they just say in front. And that's where they get their names from. So we will be looking at the serratus posterior and superior. I also thought they didn't show it. No, we'll get to them later. We're also going to look at inner rib muscles too. But let's first look at the diaphragm. So please, what's hard about this course, I love the facial expressions. Oh my gosh. What's hard about this course online is it's so 2-dimensional and bodies are so 3-dimensional. But do you guys see the red muscle there? If we could put our fist up inside that muscle from the stomach. It is a mushroom. It's hollow on the inside. It would cover my whole fist. You wouldn't be able to see my fist, but it's hollow on the inside. You were looking at a mushroom inside this person's chest. And the mushroom, very simply put, attaches to the walls of the lower walls of your ribs. It's actually sewn in to your ribs going around there and your spine from the inside. So it's an umbrella or a mushroom where the edges of the umbrella are all attached to ribs. So it is extremely confusing the way your book puts it here. I don't know if there's a better way, but it's extremely confusing. But forget about costal attachments and lumbar attachments and sternal attachments. It's a bunch of baloney. It attaches to the inner surface of your lower 6 ribs, the lumbar vertebrae that are in back there, and the sternum that's in front there. It literally is just attached around. I wish they kind of explained that better. Does that make sense? So if I was taking our skeleton here, oh my gosh, I feel so bad. We're gonna have to take away her abs. Sorry, hun. All right. But if I just went around your lower 6 ribs, which is 1, 2, 3, 4, 5, 6. It's right here. If I just went around here, of course I would attach a little bit to the sternum, these lower 6 ribs, lumbars, you know, whatever it is, 2 and 3, I think it's got in there. And of course I would attach in here. So that's what it's doing. And then it says it has an insertion of a central tendon. That's super confusing too, because essentially it doesn't have an insertion. What they're trying to do is get this muscle to fit in the origin insertion format. That central tendon is literally the tendon running over the top here. It is hooked to the fascial sacs that are around your lungs to help pull that down. But it's not really attached to their bone. They're just talking about the fact that there's a tendon running through the top of this thing, so that when it comes down, that tendon grabs any material that's on it and pulls it down with it. So best I can tell you is think about this thing like a mushroom or an umbrella. The edges of the mushroom are attached to ribs and sternum and lumbar vertebrae from the inside. And the central tendon is kind of like the top of the umbrella. Yes, Miss McDowell.
Because there's like other stuff in the way, this isn't a palpable muscle because it's protected, or
Yes.
you can palpate it.
No. So you can essentially not palpate it. I'm sure, by the way, that you could slowly work your hand under a rib here a little bit and maybe get to it, but you'd be going through all these abdominals and all this kind of stuff, and I don't know what effect it would have. That said, it is not palpatable, but you can affect it. You can kind of stretch this muscle. And what we do with this muscle, and this is a kind of a clever thing to do with other areas of the body when you find yourself like, I don't know how to reach that. Well, you can't reach this muscle, but you can reach everything it attaches to. So one of the tricks I do is get somebody to take a deep breath and then relax and push their ribs up, which stretches this muscle and the abdominals that hook to it. And it's something I'll have to literally just show you guys. So we'll come in and we'll push under ribs in lab. That's good fun. Good fun. It's a little freaky, but it works and it's very effective. And so that's how I open up the diaphragm, is to actually push against your ribs and force it to kind of stretch out. Yeah. So we'll elevate your ribs. Yes, Miss Crody. Miss Crody, yeah.
After somebody hits your stomach, so and you can't breathe. So what happened to that?
Can you say again? I didn't understand you.
Like
If you fall on a football and you get the wind knocked out of you, how is your diaphragm affected? Does it not contract? That was her question.
Yeah, I love that question. I don't know what knocks the wind out of you. I honestly don't know I should. I've never had that question. I've never really thought about what knocks I mean, I understand the concept that you get hit and that blows all the wind out of you, but I think the real question is, why is it so hard to take another breath then after that? And I don't know that. I mean, you physically, by the way, you punch somebody or something, or they land on a football, you are literally knocking the wind out of them. That makes sense, because you're pushing on their stomach and the air is coming up and they're done. But what I don't know is why, when we say that wind got knocked out of us, that we have such a hard time taking the second breath. I just don't know the answer to that. Sorry, but I encourage you to research it and let me know. Sorry. Yeah.
thank you.
Sorry. Yeah, that wasn't a very good answer. Miss Sarno.
Yeah. Hi. I have some someone I see and they go really have a bad time in the diagram and they get like tucked and shot up inside the rib cage and they get harder.
Yeah. And so what I try to do with those people is I actually try to push up on the rib cage from down here. I'll show you guys in class, but essentially it's very hard to see from here, but let me tone this down just so you can at least kind of see. I will actually take my hands and put them right here. I'll find this edge and I gently put them here, but I will push this rib cage up and over. And when I do that, it causes the rib cage to expand and it really opens up the diaphragm. It's pretty effective.
And they say hard to breathe.
And that,
They just halfway, they're not completely breathing out.
that is a very good description. They are not completely breathing. Yeah, it's very small breaths, right?
Yeah.
This could be part of the problem. So we need to open up the rib cage, and we're going to push on it. I'll show you tomorrow in lab. I'm going to push on your rib cage, you and me.
Because they feel they cannot go nowhere. They just go this way.
Yeah. Tomorrow, come get me and say, push on my ribs. I'll show you. I really will. We'll do it. We'll go nuts. Yeah. It's fun. All right. Are you, Ms. Crody, are you raising your hand? I keep seeing hands go up in the...
Yeah.
Okay. And a kitty cat.
Yeah, Philip says that we could website find out.
It's a spasm in your diaphragm that causes you not to be able to inhale.
Got it.
It is your diaphragm that's affected.
Got it. So it is. So we literally knock the wind out of you. That makes sense. But then the diaphragm spasms and you can't get it to activate again. That makes sense. Yeah. Thank you. Thank you. Thank you. Hi, kitty, kitty. No, nothing. Okay. So anyway, everybody remember, it's a big umbrella. And then when it contracts, it actually shortens and it comes down. And that creates a vacuum in your lungs, and that's where the air comes down. But it's attached to your ribs, so we can move your ribs. And I like working this muscle not just for breathing things. I like to move your ribs around. But remember, it attaches to your low back from the inside. So I sometimes even work it when I think there's back problems. And I think maybe the diaphragm is affecting that from the inside. Because it attaches to an awful lot of important stuff. So I'm happy to stretch it out. I've never seen a downside to stretching it out. So I guess I'm now committed to coming around and pushing on all your ribs tomorrow. So I will do that for people that want it. By the way, you don't have to have me push on your ribs, but I will come show you guys that. But anyway, manipulating the ribs is actually really neat, and not a lot of therapists do it. In fact, I don't know any, except us guys, the cool therapists. Yeah, Miss McDowell.
Could you explain what the central tendon is? I see it's like the white thing kind of on top of the diaphragm, but I don't really understand what that is.
It is the white thing on top of the diaphragm. It is, you know what it really is? If we could cut this thing out, because again, we have to kill somebody every class, so let's kill this person. Let's cut it out from around the ribs and the low back, around those lumbar things and around the sternum, and pull this thing out. And that part, and you gotta remember, you now have a big piece of flank steak, essentially. You've got a big piece of steak. That's what muscle is. That's gristle. It's a tendon that's buried in the muscle. It's there because, by the way, you've got some sacs around your lungs that it also attaches to, and it kind of helps, it pulls that down. But it doesn't even have to do that. The fact that it just flattens creates a vacuum in your thing. But it's like a piece of tendon in the muscle. It's gristle. Really, if we ate it as a steak, you guys would just be cutting around it. You wouldn't even know it was a diaphragm. You'd be like, this is kind of a weird looking steak, but you'd have to be like, what's this tendon little strip in the middle of it? It's just where it all comes together, and that's where all the fascia is kind of bound up there. It really is like a piece of white gristle.
Okay.
Yeah.
It's an interesting way to put that.
It's an interesting way to put it, but I don't know a better way. Like, I think that's really, yeah. Yeah.
So is that kind of like where, like, you know, how it's kind of like you said like a mushroom shape, like a circle. So if it's coming from like the back and the front, like that's where the muscle fibers.
Yeah. It's where they kind of converge, and so there's a lot of fascia. There's a lot more fascia in that area, and they call it the central tendon.
It's kind of weird that they say it inserts into that if it's on that.
Yeah, because they used a formula of origin insertion. And it works with 95% of the muscles. And then they got to this one. I think they just should have thrown that formula out for this one and said, hey, you got this funny thing that doesn't really insert anywhere. It's attached around here, right? But they said, well, all these fibers seem to go to this thing, and there is some stuff there. We're going to call that the central tendon. You will never, ever need to know about the central tendon as a massage therapist. You do need to know the diaphragm is this mushroom-shaped thing, and it's attached to the ribs, the low back, and all this kind of stuff. But the central tendon is not super important in and of itself. We're never going to touch one. Even in cadaver lab, I don't think we're ever going to see one. It's way up there. But yeah, so I think they're just trying to get a square peg to fit in a round hole for this one muscle. To me, this muscle has only, here's what I really wish they would do, by the way, with these type of muscles, is just stop saying O and I and call them attachments. These are just the places that attaches. It doesn't really work off origin insertion, yeah. Or you could say, sorry, I don't mean to beat a dead horse here, but you could also say all the left side stuff is an origin and all the right side stuff is insertion. That's more true to me, or vice versa, because these are the guys that are going to kind of pull and make this thing come down. Yeah, but anyway, however we want to look at it.
Thank you for explaining that, Dan.
With the gristle explanation, yeah. One of my better ones. Thank you for asking. Okay, so that's your diaphragm. If anybody asks you, and you will see it on not only tests like today, but I'm sure you'll see it on tests for the rest of your life, what is your main breathing muscle? You will say diaphragm. If I ever ask you what is your main breathing muscle, you will say diaphragm. Miss Sarno. Miss Sarno, what is your main breathing muscle?
Diaphragm.
Yeah,
Fram.
diaphragm.
Diaphragm.
Thank you, ma'am. Thank you. That's good. Yeah, that is your main breathing muscle. Miss Young. Miss Young, don't think you can hide from me. Come on back here. Where are you? Quit talking to your sister. June?
Hi.
Hi.
She'll be in a minute to go to
Oh, that's
a
June.
bathroom.
Okay, June. June. June, what is your
Yeah.
main breathing muscle?
Diaphragm.
Diaphragm. Thank you, ma'am. Thank you.
Thank you.
When she comes back, I'll ask her. All right. Okay, so everybody, that's your main breathing muscle. You use that all the time. And just remember, you are using energy to breathe in. You're not really using the energy to breathe out right now while you're listening to me. For example, you're just like, your diaphragm's not even fully contracting. It's going, right? But that's what we use to breathe. And it is inside our chest. And I really do want you to think about it as not only associated with breathing, but it could be associated with rib tension and even low back problems, because it does attach to the inside of the low back. And it's a neat muscle when I show you the rib manipulations, because most therapists are just like, it's a diaphragm, I can't do anything about it. You can affect it. It can be affected. The other thing I like, by the way, about pushing on the ribs is, you know me, I'm lazy. I like to do a couple things at once. I get your diaphragm expanding, but I also get your rectus abdominis and your external obliques and internal obliques, because they're attached up there too, and I push on them, and they're hard to rub. I mean, you can rub somebody's tummy, but it's hard to kind of get in there. This way I can stretch your ribs away from your hips, and that stretches out your abdominals. So that's what's kind of cool about that. It's quite safe. Ribs move very, very well. All that good stuff. Okay. That's diaphragm. Main breathing muscle, diaphragm. Okay. This is a view of the diaphragm also, as though, I'm just trying to give you a visual, as though I just can't think of a better way to put this. Our sweet skeleton, who I deeply respect, who is a lady, but this is as though I'm laying on the ground and trying to look up her skirt. This is us looking up from her feet. This is us looking up the skeleton, okay? So this is us looking at the mushroom from the inside, and it's a very good view to give you an idea of that kind of mushroom shape in the inside. And you can see, by the way, how this muscle interacts with the lumbar region, and what other muscle does it seem to interact with back there that it actually is intimately touching? It's in the picture. What is the other? What?
Quadratus lumborum.
Quadratus lumborum. So, which is definitely a back muscle. I mean, I know it's an abdominal muscle, but we all know it's a back muscle. So that gives us further reason to believe that this is part of probably your interfascial lines and stuff, and your inner stability, and that it really is. It gives you another viewpoint of this. Yes. There are some minor things just to show you, just so you're aware of them. That vena cava foramen, you will see the term foramen used a lot in anatomy. There are lots of foramens in your body. And foramen means what? Anybody?
Isn't that like a hole?
Yeah, it's a hole.
It's a hole. That's all it means. It's a hole. You've got a foramen magnum in your skull that your spine comes out. You've got You've got obturator foramen. Obturator foramen in your hips. You've got holes down here in your hip bones, and these are called obturator foramen. Foramen just means hole. So this is a foramen for your vena cava, your inferior vena cava, which is the vein that comes up from your legs and your hips for your entire body to get blood back into your heart. And the esophageal hiatus. Hiatus and foramen to me mean the same thing. But hiatus means missing. I'm going to go on hiatus, everybody. I'm going on vacation. I'm going to be missing. So the esophageal hiatus, what do you suppose comes through the esophageal hiatus? Your esophagus, your food pipe. It's got to get down past because your diaphragm covers your entire, it separates your lungs from your entire lower part of your abdomen. You've got to get your esophagus through there to get down to your stomach. And so that's where it comes through, right there. And the abdominal aorta, can you see it underneath the esophagus? That is a hole for your abdominal aorta, the big blood pump to come down through your diaphragm again and get down and get blood to the lower part of your body. Those are just the holes that are going through. So you have to put some holes through this umbrella, or we never get any stuff from the top of your body down to the bottom of your body. I just want you to be kind of aware of that. But you don't forget, foramen means hole. Hiatus essentially means hole. Hiatus means it's missing in that area. Okay, cool. Good stuff, everybody. This is somebody kind of palpating the diaphragm, to answer your question. This is the only way you can kind of touch it. I don't really consider this touching it, but okay. But I do kind of do what this person's doing in the picture to push on the ribs. Yeah, because that's, to me, is better than grabbing the diaphragm. I can get more diaphragm this way. Okay, let's talk about some other stuff. Do we need a break before we go on other stuff? How are we doing? Yes, okay. Mr. Placencia nodded, and he's a very quiet man. And when quiet people speak, I listen. So, 15 minutes, sir? Is that correct? Okay. Mr. Placencia says, all right, let's finish this next one up. The intercostals, inter means between, and these are between your ribs. Please do not worry about the origins and insertions for this muscle. It's like the inferior border of the rib above. That really means the bottom of the rib above and the top of the rib below. And they're muscles between the ribs, period. That is a completely acceptable answer for anybody. All that good stuff. So, your intercostals are muscles found between the ribs. You do have internal and external intercostals all found between the ribs. So what I really mean by that is just like your internal and external obliques, you've got muscles running opposite directions all between the ribs. Right? But on one side of the ribs, you kind of see the fibers going this way, and on the other side, you'd see the fibers going the other way. Who here likes to eat ribs? Yeah? They're delicious, huh? I get it. Trust me. Yeah? You are eating intercostals, though. Quite literally. And the reason I tell you that is it's kind of cool, actually. If you are a rib eater, and they are delicious, I get it. Take your ribs next time and flip them over. You'll actually see the fibers running in opposite directions on each side. And that's these inner and outer that's these external and internal intercostals. As far as this class is concerned, I could care less. I just want you to know that there is rib meat, there is muscle between the ribs that's active. And it can actually, because of the way the fibers run, it can actually help to expand your ribs or contract them. And you don't need to know which does which. Because when you rub them, you're rubbing whatever you can get your fingers into, right? So, your intercostal muscles, depending on which way they go, can either open your ribs up or close them down. If it helps to open your ribs up, what are they helping you do? Anybody? If they're helping to expand your rib cage, yes. What are they helping you do?
Inhale.
Yes. Inhale. So, and if they are collapsing your rib cage, right, as the internal ones do, what are they helping you do? Yeah, you just, yeah. That's just like
Exhale.
I'll give you one. Yes, exhale. Thank you. Well said. So these muscles, you don't use them all the time as far as we know. You use them when you need extra force, and they probably kick in during those times and help you to expand and contract your ribs when you are doing when you need extra assistance with inhalation and exhalation. Usually when you're running or something. And that's your intercostals. And inter means between. Inter means between, which is different from inner, which is inside. Intercostals, costals are ribs, meet between the costals. So that's why I said you can count these. I count as one muscle really, but there's two muscles there running opposite sides. And those are your intercostals, and they help you to expand and contract your ribs as you inhale and exhale. Cool? Can you rub intercostals? Yes. And I don't have any fancy ways to do it. Like I start on somebody's back and I find their ribs and I get my fingers between them and I pull around there, right? I come from the front, I find their ribs, and I pull around. It's very time consuming work, but if you really thought somebody was, well, Ms. Sarno's client, where she says that he has a hard time breathing, this would be one of the things I would do. I would push up his ribs to open up his diaphragm. And then I would work between his intercostals to help open those up too. Those are two things I would do for sure, just to start. And those are your intercostals, yeah? Cool. Cool. And then, last but not least, on the back side of your body, the posterior side, we have an excellent picture here of half of the serratus posterior superior and half of the serratus posterior inferior. Please do not forget there's muscles on both sides. Your book just only shows one side. And think about it, the ribs move, the spine essentially in this situation does not. So the muscles on the top, the superior ones that are coming down at an angle, if they contract and the spine can't go anywhere, the ribs have to go somewhere, what does the serratus posterior superior do when they contract? They elevate or expand the ribs. They lift the ribs up, which if you kind of watch somebody breathe, the ribs don't just expand, they kind of lift up. They kind of come up. Anyway, the serratus posterior superior can help that. Then you've got the serratus posterior inferior, and it's down below. If it contracts, it's going to depress and contract and collapse the rib cage to help you to exhale. And again, you usually only use these when you need extra fast, hard breathing, when you are breathing hard. But I don't know if you've ever gotten a stitch in your back. I'm sure you've gotten a stitch in your side before, that feeling. But stitches in your back are usually, these aren't real stitches, everybody. We're talking about a pain back there. These are usually in your serratus posterior, superior, and inferior. And they're cramping up on you for whatever reason. But these are breathing muscles too. They are extremely deep, extremely deep. But you can rub them. Essentially, the superior ones are underneath the rhomboids, and the really low ones are essentially by the QL, really, the quadratus lumborum. So it's really just more to make you aware of this. If somebody's having breathing problems, I really want you working on the rhomboids anyway, because that could be part of the problem. But underneath them is this serratus posterior superior, and working the QL is never a bad idea with back problems and stuff. But anyway, the serratus posterior inferior is down in there too. It is very hard to isolate and find these. These are very flat muscles. If I'm rubbing them, I am rubbing them on purpose, but I know the whole time I could be rubbing other things. Does that make sense? I just go to that general area and start loosening up. So we've now identified 1, 2, 3, 4, again, depending on how you count it, 5 breathing muscles. The number 1, the main breathing muscle that I'm about to ask Miss Zhong what it is, but the main breathing muscle is the diaphragm. So I'm about to ask Miss Zhong what is the main breathing muscle, and she's going to say diaphragm. Miss Zhong, what is the main breathing muscle?
Yeah.
Yeah.
They are
Yeah. It looks that way. Diaphragm. Yep, that was it. Diaphragm. Beautiful. That is the main breathing muscle. Thank you. So, and then we have lesser breathing muscles that help us when we need extra help. We're trying to get oxygen really quick and out really quick, and that would be the intercostals, both the interior and exterior ones, and the serratus posterior superior and serratus posterior inferior. Boom! And again, we care about all this because when people can't get a big breath in, forget it. We know, by the way, 100%, we know for a fact that oxygen availability to muscles helps keep them loose. So if somebody's not getting enough oxygen, all their muscles in their body are probably tight. Right? Again, this is kind of why yoga works too, right? Is because you are moving and getting oxygen to those muscles and they're actually opening up and getting looser. Oxygen, blood is life. And so if your clients are having a hard time breathing, it also makes them feel a little bit panicked, even unconsciously if they're not aware of it. All this stuff helps. And I have, on actually quite a few occasions, done intercostal work where I'm working between the ribs and things like that, but it's usually almost always for a client who's complaining about not being able to breathe. So let's talk about Ms. Sarno's person who's having a hard time breathing. We might push up on their ribs slowly to open up their diaphragm. We might work their intercostals to loosen that up. And then we also might go to their backside and try to rub their rhomboids to also get to the serratus posterior superior, the QL, quadratus lumborum, to get to the serratus posterior inferior. And then I would actually hit, even though it's not a breathing muscle, the serratus anterior, because it could be fighting with the rhomboids, and that's creating that belt around the chest. And that would be my solution, or I shouldn't say it's not a solution because it may not work. But that would be my first line. That would be my first line of attack. If you came to me, any of you came to me and said, I'm having a hard time breathing, and I didn't think, by the way, that you need to go to the doctor. If it was just tension, I would first release your rhomboids and your serratus anterior to make sure they're not making a belt around your ribs. But then I would hit serratus posterior superior, serratus posterior inferior, intercostals, and your diaphragm by moving your ribs. Yes, Miss McDowell.
Didn't you say that having like a tight pectoralis major could also be a
Sorry.
breathing thing?
I should have said pectoralis minor because it works with serratus.
Yeah.
I mean, pectoralis major might, but it's not the main culprit. Pectoralis minor, I should have always thrown with serratus anterior. Yeah. I don't know that I want to make, you know how I have that thing where I say latissimus dorsi and you say teres major, and I say teres minor and you say him for spinatus. I might start saying, like, I say serratus anterior, you say pec minor. Because serratus anterior and pec minor both protract you, both depress you, both do those same things. So I could, yes, I should have thrown it in there, though. You're absolutely right. Thank you. And so, yeah, pec minor in there would be a very good one to work because that could be stopping them from breathing. And by the way, in my experience, it's the rhomboids and the serratus anterior and pec minor. They're the first things I hit, and they're usually the biggest problem. The little inner rib stuff and the diaphragm stuff, that makes it better, but usually the bigger problem is just shoulder tension that's kind of starting to take over the whole body. Cool. Any other questions? Let's see. Yes, Miss Sarno, please.
Yeah, sometimes I have a customer like a one like here like pack
minor?
minor.
Pec minor, yes.
Yeah, pack minor. One side high, one side low.
Oh. All right, so what she
And
said.
what it cause will be that from the patient or get something like they not expecting or get upset or
I don't know, but I do know
what
that
it cause.
when we see unevenness on both sides of the body, there's a problem. And so I try to figure out which side is tight and work that side and start loosening it up. Yeah. Because you're saying one side's tight and one side's not? Yeah.
Yes.
That kind of unevenness, you're right, is a sign of a problem. I try to figure out which side is the bad side and start loosening it up.
Just this side.
So start loosening up pec minor on this side, but I even do the back, this whole side, spend lots of extra time on to try to get it so they can be even. Right? I don't know if that helped what I just told you, I hope.
Yeah.
Okay.
It help because sometimes I need the vision like I need to like have someone like okay point to something I can work it on.
Oh, good. Tomorrow, I really mean this, I'll come show you about the ribs and we'll get in the pec minor a little bit and we'll talk about that.
Thank you.
It will be amazing. Yeah. It's going to be a good day. Tomorrow's going to be a very good day. All right. Anybody else? I just released 2 video.